Cool. So we are just gonna be marking the spine today for Karen. Obviously, after you've done tissue prep and kind of warmed up the area, then you could start marking. So the first thing we do is marking the seps, or the area in between each vertebrae. And you're kind of actually marking the vertebrae itself, but you're feeling the seps as you're trying to find each one. Sometimes I put numbers by the side so I can just kind of have a marker for which vertebrae I'm at and know without having to count each of them. Stand up here, sorry. Just a little. Okay, I'm just gonna squeeze that a little. Okay. And then once you get the spine marked, then you can go in and start taking the tension and hyperesthesia findings. We like to start with the apicals, so the annans and poens first. So Karen, just let me know as I'm pushing on this if there's any pain or tenderness, if it gets better.
No pain.
Not there. In here?
No pain.
In here?
No pain.
Here?
A little tender.
Okay. And does it get better, worse, or stay the same as I hold it?
Better.
Here?
Yeah.
Here? You're kind of marking the tension findings, and you'll find ways that you like to do it that make it a little easier, but I like to only mark max tension, and if I don't mark, or I mark max tension and mean tension if you do find it, but I mark that, and then I also mark the hyperesthesia only if we find it. So you kind of find how you like to mark so that it doesn't get too busy when you're actually marking on the spine. So this one, Karen, any?
No.
Here?
A little tender.
Okay, better, worse, or stays the same as I hold it?
It got better.
Okay. Here? Here? Here?
A little tender.
Better, worse, or stay the same?
Better.
And here? And here? Better, worse, or stay the same?
It stays the same, yeah.
And here?
Yeah.
Same thing, better, worse, stay the same?
Stay the same.
Okay, and then here?
Yes. Stays the same.
And then here?
Yeah.
Stays the same? And then here?
Yes, stays the same.
Okay. Sometimes I do that, or I'll get a few findings and then kind of go back and mark just to keep it flowing a little better. But so she has mostly, actually all kind of poens are like posteriorly situated vertebrae, and then some of her hyperesthesia kind of coincides with that because it stays the same as you press it, so it needs to kind of be moved anteriorly with the treatment. So then after you take all the apical findings, you can go ahead and actually treat those before you take the lateral findings. So for these, we just kind of go through and do our anterior treatment for the vertebrae. And you kind of have to adjust depending on which vertebrae you're working on. So up here we can do our double twos and kind of get more of that motion, but down here sometimes you need to adjust and use a different contact so that you can get the transverse process on the vertebrae itself. Is that okay, Karen?
Yes.
And then you kind of want to remind the patient to breathe also as you're doing it. So take a big deep breath in. And out. And in again. And out. again, big deep breath in and out. And then in and out. Good. I'm going to do the same thing a few more times. In, and then in and out. Okay. And again. And then in and out. And then one more big deep breath in for me. And out. And then in. And out. Okay. So after you take all the apical findings and then you treat them, then we can go on and do the lateral findings and the rotational findings. So let's see. Any pain or sensitivity on this side?
Mm-mm.
Any here?
No.
Okay. Any pain or sensitivity?
No.
Here?
Mm-mm.
And again, for these, I like to just mark the tension and hyperesthesia if she has it. But if I don't put any marks, then I assume that it's no hyperesthesia. And if there's no mark for tension, then it's min tension. That's just how I like to do it. Any pain or sensitivity here?
Yeah.
And here?
Yeah.
Any here?
Mm-mm.
Any here?
No.
Pain or sensitivity here?
Mm-hmm.
Any here?
Mm-mm.
Okay. Any here?
Mm-mm.
Any here?
No.
Pain or sensitivity here?
Mm-mm.
On this side?
Mm-mm.
Any here?
No.
And here.
Mm-mm.
And I'm using my middle finger as the kind of contact to get the finding itself, and you'll start to feel it a little better as you go. You're actually moving the spinous process to feel the tension. Any pain or sensitivity on this side?
Mm-mm.
Any here?
No.
Any here?
No.
And here.
No.
Pain or sensitivity?
No.
Any here?
No.
Any here?
Mm-mm.
Any here?
No.
Any here?
No.
Here?
No.
Any here?
Mm-mm.
Here?
No.
Any
No. Mm-mm.
here? Here?
Mm-mm.
Okay, and then the last thing that you want to take findings on after you get all your lateral and rotational tension is the oids, or the opposite in direction, and those are just kind of confirming your tension findings. And these ones you're just finding tension, no hyperesthesia. Cool. And normally I take all my findings standing, but just for the video, I'm taking them seated. But yeah, and so then once you got all your oids, your lateral and rotational, you can treat those as well. And so for the lateral treatments, you'll want to move the vertebrae just laterally. So we're using 2 contacts and we're pinning the transverse process and then sliding into the vertebrae, the spinous process, and laterally moving it. And then for the rotational findings, we would just kind of use our contact 6 and then rotate the vertebrae. So she actually doesn't have any that she had hyperesthesia on, which would indicate needing to do the rotational treatment. So these are all laterals, but I'll show some of those. Okay, so I'm pinning, sliding. Does that feel okay, Karen?
Yes.
And you can kind of feel when it starts to get less tension, or if it starts to, you don't want to move the vertebrae too far, so you can also have the patient let you know if there's any sort of like crimping or any of those like bad pains or anything like that. Does that make sense, Karen?
Yes.
Start to get like grumpy.
Mm-hmm.
Feel okay?
Yes.
Still feel okay?
Mm-hmm.
Sides are okay?
Mm-hmm.
Still doing okay?
Yes. Doing good.
Good. Almost there. And some of these, as you get towards the top, you might need to again adjust kind of your contact. Find a different way to get the motion that you want. Does that feel okay?
Feels a little tender.
Okay, up top here.
Yeah, up in the top. Mm-hmm.
This one's a little. And then, is that okay?
Mm-hmm.
Then you start getting into these muscles, which are always tender too. But yeah, so that is pretty much it. How you would treat the entire spine. Always make sure to check in with the patient throughout the treatment and make sure that you're getting feedback from them if anything hurts. And then after this, we kind of go back in and recheck some of the tension findings, make sure that things feel kind of more equalized, more need tension. And then if she was having any, pain or sensitivity in a certain area, then we would want to make sure we test those areas and make sure that that is gone. Yeah, so that's it. Pause it, Karen.
Yeah.